We are excited to today launch into an unstructured case interview and give you just one example, one data point of what that kind of conversation could sound like. I was thinking back to, when me deciding to join McKinsey and my path interviewing there. I was certainly at a post MBA level, but 3 out of the 5 interviews that I had at McKinsey in my journey were in the, I would call, unstructured bucket. And basically what that means is that the interviewer is going to sit there and they don't have a specific game plan, and they don't have the full answer sheet, right? But they are talking about like a piece of work that they do all the time or something that they're very familiar with. So let's see how one of those conversation goes. Before we dive in, we've got Lance with us here today. Lance, thanks so much for being willing to raise your hand and try this out with us.
Of course. I'm Lance. I am a current undergraduate at the Wharton School. I'm studying operations and management, and I'm really excited to be here today.
Awesome. Lance, so just talk to me a little bit, right? How do you feel like your case prep's going? Where do you feel like you're at?
I think I'm really excited for today's case prep because the unstructured interview is something that isn't really talked about. I know this is management consultants' first time to do it, and I personally haven't done something like it either. So I guess we'll see how today goes. But then I think in terms of case prep, my greatest advice would be to honestly take breaks if you can. I found that my greatest improvements have been when I, sat back, took breaks, and then try to do it again. Currently, I think I'm at a Zen period. I'm not kind of cramming casing, which I thought kind of pays off dividends.
Absolutely. Love that. And kind of naturally, what do you think are some of your strengths and weaknesses in terms of casing?
Right. I think in terms of casing, my strengths would definitely be the math portion. And I think also brainstorming a little bit is something that I'm getting better at over time. But then definitely I think I could be more concise when I'm speaking, especially when I'm speaking about graphs and when I'm speaking about my frameworks.
Awesome. All right. Well, I've done these before, so we're we're all good, and we're just trying it out. We're just going to jump in. Okay. All right. So let's do that. Okay, Lance. Now, thanks so much for tell me a little bit about yourself over the last few minutes. Definitely interested in this time, though, as well. Would love to just chew on a business problem with you. So let me give you a little bit of the setup. So let's say that your client is a multinational life sciences company, and they take part in all different sorts of types of business, right? I mean, they've got like a pharma angle, they've got different therapeutics, they've got medical devices. So today, let's assume and let's look at and consider our client is going to be in the med device space. Now, medical devices, these can be things that are internal to the body, or they can be external to the body. And there's a lot of different pathways that engineers, innovators, designers are going to kind of go through to be able to get that final product approved and then get it to market. So our client right now, let's say that they've got both a robust internal engine, kind of like an incubator, to try and design and develop different types of products. And they also do take part in M&A activities as well. So, we've come into this situation where we're not the specialists or the experts in the space. We're not the regulatory consultants, but we're really helping them try and, boost their efficiency and effectiveness of these different product design, product development groups. So yeah, just interested in your initial thoughts about kind of how you would think about this.
Right. Yeah. So I guess, first of all, thanks so much for taking the time today to run through this business problem with me. I'm really excited because I also actually wanted to go into life sciences right as I started undergrad, but then eventually I decided to come into business. But then just to make sure that I have everything on hand and to make sure that we're on the same page, our client today is a multinational life sciences company that has two arms, an internal and external kind of medical devices arm, right? And that's our focus today. And so basically, there's a lot of steps in terms of trying to get the medical devices approved, developed, and even sent out into retail. And so our question really today is how can we boost the, I guess, designing and the manufacturing of these medical devices in terms of their efficiency and product design.
Okay.
Yeah. So I don't know. This is a really interesting problem. I definitely would like to ask some questions before I kind of dive deeper into this to get a better sense of the client. So my first question would be, is there really anything that is particularly alarming about their current product design and product manufacturing process?
In our conversations with the client so far, there's nothing that they're really kind of highlighting or pinpointing that's going wrong per se. No? Yeah. Certainly the company wants to improve its bottom line and, increase profitability. And as another metric that we know that they're thinking about, they are thinking about kind of how many products that they are getting into the marketplace.
Interesting. Okay. And when you say how many products, are you thinking about the sheer number of products, or are we thinking about, product mix and making sure that we're diversified throughout, say, for example, the internal and external medical devices sector?
I think all that's going to probably be important moving forward, right? I mean, they're going to want to think about how many unique new product launches they have, as well as looking at the breadth and depth of the diversity of their portfolio, seeing, et cetera. So they're going to be looking at all sorts of things.
All right. Yeah, I think that sounds good. Could I just get a couple seconds to figure out how we can go through this problem together then?
Okay, sounds good.
Yeah, thank you. All right. Yeah. So really when trying to diagnose, right, and figure out how we can increase manufacturing efficiency and the efficiency of product design, I'm going to structure this problem into a 3-step process. The first step really is by looking at just the overall manufacturing capabilities of our current multinational life sciences company. The second one really would be looking at how they conduct research and development, seeing as this is a very important part of product design, especially in the medical devices space. And then finally, I want to explore different avenues of how we can realize kind of cost reductions and gains in revenue in order to, at the end of the day, boost bottom line profitability, right? So we'll go through that in order. When looking at manufacturing capabilities of our current multinational life sciences company, I'm currently looking at 3 to 4 things, right? So firstly, I'm really trying to understand the connections that we have with our suppliers and our distributors, right? I think that's really important, especially given in mind that the goal of our life sciences company today is to roll out as many products as possible. But also it is really important in making sure that we get, the right product and we get them at the cheapest cost possible in order to make sure that our manufacturing is as efficient as possible. Secondly, in terms of, you also mentioned earlier that there is a lot of steps when it comes to product design and product manufacturing. So I want to have a look at their operational efficiency, taking a look at, for example, where are we delivering things, or where are we, I guess, producing one part of a certain medical device, another part of a certain medical device, and trying to see where that comes together, for example. And if there are any operational efficiencies that we can leverage, I think that should be something that we should look at and make sure that the process is as efficient as possible. And then finally, I really would also like to look at, say, for example, the multinational differences in efficiency. I would like to assume that the multinational company operates in different parts of the world, and so manufacturing is different in different parts of the world. So really, trying to see where labor-intensive products can be produced in, labor-abundant places. I think that's something that can be leveraged within this whole manufacturing space in order to make sure that we are as efficient as possible. Looking at my second bucket, looking at research and development, here I'm really looking at two things, right? And I'm looking firstly at the internal expertise that we have, really evaluating the different members of the board, for example, or really evaluating the different types of engineers that we have, to really see if we are fulfilling the needs that the market has with these people that are working within the company and really, spearheading this research and development, right? And my second one, the second avenue I would like to evaluate R&D by is by looking at our mergers and acquisitions. This is something that you mentioned earlier that we do engage in. And so I really want to have a look at the companies, we've merged with, or the companies that, in general, we've just collaborated with, to see if there's anything within that will actually really help us realize a lot of capabilities within our R&D that we aren't realizing yet. And so when really trying to evaluate that, I'd like to move on to my third bucket, right? Looking at the realization of A, cost reductions, and B, revenue increases, right? So when looking at cost reductions, I think there's a lot that we can look at. And so really trying to look at how we reduce fixed costs and variable costs is definitely something that's important. But I think what's going to be particularly interesting in this case is by looking at how upfront costs are going to be reduced, right? I would imagine that a significant cost within our life sciences company is just research and development costs and the upfront costs that are associated with trying to venture into a new product and a new medical device. So that's something that we should really look out for today. And secondly, looking at different revenue increases that are associated with different product mixes. This could be analyzed, for example, by looking at the demand elasticities of people to make sure that we are selling things at the right price. And by really looking at the interaction between price and quantity of the devices that we sell and the variety included within that in order to make sure that we are able to generate as much profit as possible, right? And so really when looking at this overall problem, right? I think that the most important thing that we really first need to look at is just the whole manufacturing aspect of it. It seems like our life sciences company, because it is already multinational, is rather successful, right? And so we really want to make sure that whatever we already have is already really established before we move into, looking at R&D. So I would like to propose that we first have a look at the different manufacturing capabilities that we have, possibly by looking at the operations, if you have any information about that.
Okay. All right. Yeah, that was a lot, right? That you just went through. There's a lot of different component parts of what could be going on here. You know what? Actually, in terms of this medical device unit, right? This large division within the broader company. Yes, they are ultimately engaged with and responsible for getting that product to market. Sometimes that will include manufacturing internally. Many times, though, that will also include partnering with external manufacturers. So it won't be, for this client, it won't be holistically something that they always own. Depending on the complexity of the device, the materials used, et cetera, there may be some real specific manufacturing requirements here. And so our client won't always handle all of that internally. So does that make you kind of rethink that bucket at all, or kind of what do you think would be important there?
Yeah. So, the bucket that I mentioned was looking at our relationships with suppliers and distributors, looking at our current operational efficiencies, and by really looking at, the whole multinational aspect of it, and making sure that we produce labor intensive products within labor abundant countries, for example, right? I think definitely looking at our internal operations is something that we don't necessarily need to do. But then really having a look at how we negotiate with suppliers and distributors, for example, is something that we would still need to do, right? Possibly also when looking at, just the fact that our our life sciences company collaborates with a lot of different people and a lot of different companies. I really want to understand our relationship with complementers, for example, right?
With what, for example, Lance?
With complementers.
Okay, meaning?
So medical devices, sometimes they're just one huge piece of medical device, but then sometimes you get two-part medical devices that are produced by two different companies, one within our company, but then one within someone else, right? And so really looking at, say, for example, profit sharing and really looking at how we market, for example, these products, I think is something that would be really interesting to look at.
Okay. Let's shift our focus here though a little bit, because let's imagine for this client as they try and design, develop, market, and ultimately launch products. There's a lot of steps to get from the seed of an idea to a launched product, and so the way that this client organizes is really in kind of large product teams within the broader division that's going to be fully with leadership who's going to be fully accountable for that entire process. What would you imagine might be some of the different steps on the process from idea to launch?
Yeah, could I just have a couple seconds to jot some ideas down then?
Okay.
Yeah. And when we say launch, are we talking about having the products on shelves or available to our final buyers?
Yeah, when it would be actually available in the market.
Okay, yeah. So I think I've thought of a couple steps.
Okay.
Really, the first one is by looking at the market analysis, right? So when we have an idea, we need to make sure that the idea of whatever medical device we have really fulfills our customers and our buyers' needs, right? Whatever that might be. Secondly, looking at the capabilities of our company, and in the case of this particular life sciences company, looking at the capabilities of the companies that we actually do work with and collaborate with in terms of manufacturing, right? Okay. So when looking at these capabilities, we're looking at operational capabilities, but we're also, looking at financial capabilities, right? Do we have the current capital to actually venture forward with this, or do we need to take on debt, or do we need someone else's help, right? And there definitely would be a lot of financial analysis to make sure that, the risk of actually losing money as a result of this venture is, really low, if not none, right? Just to really make sure that we have a lot of profit in the end. But also, I think there are a lot of, I guess, more intangible things that the company can do in order to make sure that the product is ready for launch, right? So there would be product testing, for example, after the product is manufactured. There would also be a lot of, really looking at how, A/B testing and looking at how the market does receive the product, right? And I imagine within this particular life sciences company, there would be a lot of the testing, like how we've seen in COVID vaccines, for example, right? And so really when looking at that, I think those are all really important parts of the manufacturing and product design process before we actually get them on shelves.
Yeah, product design, product testing. I mean, that's going to be really important here. One of the first things that these groups is going to do is they're going to, from either a product idea or the identification of a customer need or a patient need, they're going to need to gauge the size of the opportunity. And so, let's say that internally within an R&D type kind of function, somebody comes up with the idea to, they've come up with, let's say, a new leg brace that currently doesn't exist in the market. How might they go about thinking through how to size the revenue potential there?
All right, so we're looking at revenue potential for a leg brace that someone's just come up with. Are we looking at just the US market, or are we looking at a wider market here, because we are a multinational company?
We are a multinational company. There would be different regulatory processes that the client would have to go through, yet we would want to look internationally.
Internationally, okay, yeah. I'll just take a couple seconds to structure out that calculation, and I'll get back to you really quickly.
Okay, yeah, and you don't need to do an estimation or anything. Just wondering how you would think through it.
Okay, all right, yeah. So really, when looking at the international population, right? I think the first thing that we'll need to do is by really trying to have a proxy for the number of people that would need a leg brace, right? So say, for example, I think some data that we can calculate to help us with that are looking at the number of people that are currently in wheelchairs, for example. I'm also actually would like to backtrack and ask what the leg brace would exactly do. And I think that would just help me.
Just as a proxy, right? They as an example, let's just say, hey, a scientist came to us and said, I've got this really great idea, and now we need to help with the marketing and sales side, kind of marketing analysis. What could be the revenue potential here? And just talking me through the steps of how you would think about it.
Yeah. So when looking at the revenue potential of any new product, we need to have a look and really estimate the number of people that would use the product. Definitely have a look at how that would differ across different areas of the world, and also really having a look at say, for example, how much you need this leg brace, right? Is the leg brace something that you buy once and you can live with forever, or is it something that you need to buy twice a year or however many times a year, right? With different products, I imagine that would be really different. Also, by really looking at how we would imagine people to actually receive the product, right? So I know with a lot of new technologies, there is an adoption curve, and that not a lot of people adopt it at the start. But then once people start picking it up, and once it starts to become more famous on social media and through word of mouth, for example, then we'd see that really high increase. So there would be different revenues within the first couple months or couple years of adoption, but then later on we'd see that spike. And so when really looking at the revenue potential, we're definitely not only, conducting a base level analysis of, price times the quantity, right? But then we're also having a look at how that changes over time. And also, I guess what's really more important here is by looking at how the revenue would offset the costs, right? Because if the costs that are associated with this, new product are much more substantial than the revenue we do foresee, then it might not just make sense to move forward with the product.
Okay. Yeah. So around even just like trying to price the product, right? When we're starting with a brand new idea, how might you imagine that a group could go about doing that?
Yeah. So when looking at pricing, definitely we would want to have a look at a couple different factors. Number one, I would like to have a look at the number of competing products that we have in the market. And within that, we're looking at both direct competitors, that really serve the same purpose as the product that we currently are thinking about, but also indirect competitors, right? So having a look at products that are similar, but then might serve the same purpose. So I think that's something that we should have a look at when in terms of pricing. Also looking at customer demand elasticity for particular products, looking at how our product is differentiated, for example, is also something that we should be doing to make sure that, if our product really is differentiated, and if we are, for example, able to get a patent, then we can put a high price because people will be very much willing to pay for it. But then if our product is otherwise, and there are a lot of substitutes or, other products that fulfill the same need, then we won't be able to price highly. I think other things would definitely be having a look at just the overall bargaining power of buyers as well. I think is particularly important when looking at price. So, having a look at the concentration of us as suppliers and the concentration of, whoever our buyers is something that we should also have a look at to make sure that we do price this product correctly. But I think the final step really is to have it rolled out first within a test market to see how effective our pricing strategy is. And, if possible, or if needed, make changes as appropriate.
Okay. Yeah, absolutely. I think we'd probably coach them along a lot of those lines, right? Figure out how much is going to cost to produce. If there is already competition in the market, what is the price points of those different things? Then looking at the value that it provides to the patient, et cetera. We'd be looking at it from a number of different angles to try and triangulate. So, okay. Now, want to think about one more part of this process. When we're talking about the life sciences, the healthcare space, we're making things for people. This medical device might be external to the body. It could also be internal to the body. So different regulatory agencies across the world, different regulatory pathways. Just in the United States, there's two main regulatory pathways. There's a 510K or there's a PMA. And so let me just give you just a brief overview of what those mean. And then I'm interested in your thoughts here. So a 510K pathway, that's going to be a faster path to launch. It's going to mean that, either there's nothing truly kind of internal to the body, or they can identify predicates, previous devices, previously approved materials, devices, et cetera, that in combination that the FDA would feel like, okay, this is just, we've already basically approved this once before. You can kind of get the fast track, right? Or there's the PMA pathway. Is probably going to require, the FDA is going to want to see clinical data. So you're going to have to go through clinical trials, perhaps work with different patient populations or in different numbers, in different phases. It's going to be a longer process. So if we just looked at kind of, thinking about medical device innovation and product development along those two regulatory pathways, what do you think are going to be some of the things that our client needs to think through as they try and increase their launch of new products and increase their profitability?
Okay, yeah. So, when thinking about increasing the launch of, the number of products that are newly launched and thinking about increasing profitability, I think a balance between just efficiency and I guess the rigorousness of getting certified by, these two methods is something that our client needs to debate. And I think that's really done per product, right? So I actually would like to take this opportunity to kind of just use the current situation and the whole COVID-19 vaccine thing as a proxy for how one might think they could actually choose between either the 510K or the PMA certification, right? So you mentioned that the 510K certification was a faster launch and, you're able to identify predicates that allow for this new product to actually be developed. And then for the PMA certification, it really is a more rigorous, I need data, I need statistics, and I need to make sure that this product actually works in order to, in order for it to launch, right? Is that a kind of accurate assessment of what the differences between the two are?
Yeah, I mean, that we're just hitting the tip of the iceberg, right? But yes, it's gonna, so tell me a little bit more then what you think about that.
Yeah. So when trying to launch a new product, for example, we're definitely, I think a consideration is looking at the number of people that are going to be using this product, right? If there are going to be more people that are going to be using this product, then I would imagine that the PMA would be better as long as there's no predicate or as long as there's no preceding medical device, just because a lot more lives would be at risk, for the lack of a better term, if people, if the product is unsuccessful, right? Also looking at the degree to which the new product that we are launching actually, the degree of the new product that we're launching, how that will actually affect a person's health, right? So, a while ago you mentioned a leg brace, right? So I would imagine a leg brace is something that's external, right? And so something that's external might be better for 510K because it doesn't really, it improves the lives of people that need it, but it doesn't necessarily affect them, in a biological or chemical sense, right? But then with something like the vaccine, for example, there might be really big ramifications, right?
Yeah. And our client, we and our client, we're not going to be the ones to make that distinction and decision. Like the FDA is going to decide, okay, based on all these different factors, which of these regulatory pathways must it go down?
I see. Okay. So I think the decision that our client can definitely try to make then is by looking at, timing the different products that they might have, right? So definitely looking at predicting market demand for certain medical devices, probably looking at, what diseases might we have in the future, given these trends in demographics or these trends in, just general trends within the environment that we see. And by making sure that we develop products within a particular time span to, account for the length and the duration of, the 510K and the PMA certifications, I think that's something that our client should definitely do in order to make sure that we launch products on time and eventually increase profitability.
Okay. It's been good to chew over some of these different elements in terms of medical device, product design and development. Any kind of final thoughts as we wrap up this conversation?
Yeah, no, I just really appreciated the opportunity to have a look at, just medical devices in general. I think that there are just a lot of things that I've learned from before. I'm not really familiar with the medical devices industry. It's probably one of the first times I've engaged with it and have really deeply thought about it in this way. But then I think there are a lot of things that are applicable from other industries that you can really have a look here, adapt it, to the current situation like COVID, right? Just having a look at how the vaccine would play out, within 510K or PMA, or, gauging the size of how many people would actually need the vaccine and how many people would actually receive it. I just think it's been really fun. And thank you so much.
Okay. Break. All right. Lance, how did you feel? How do you think that went?
Yeah. I'm glad that I kind of forgot about everyone else on the call.
Good.
Really to just feel like you and me, which is great. I think overall, I was more composed than I thought I would be. So that's great because this is, I guess, my first proper interview in that sense. Looking through the different parts of the case, though, I think my framework, I took a bit too long to deliver. I think I explained a lot of things. So I would work on trying to cut that down and make sure to only explain things that are relevant at the time. But then when looking at brainstorming, I think that my brainstorming and just like having a conversation was pretty good. I think it could have been more structured though, definitely. I'm looking through my paper now and I'm not really seeing anything in particular that I could like give comments on. I'm pretty sure you could about how I could be more structured, but I think that's something I could do. And I think I should have gotten a better sense of what our client does through the clarifying questions. And I don't think my clarifying questions were as effective as it could have been. And I think that was evident when you talked about how as a multinational life sciences company, it's not just us producing these medical devices, that we also source, fully finished medical device from other people.
Absolutely. Yeah. Okay. I agree with a lot of those points. Let's dive in, right? Let's do a little bit of a debrief. So overall, at a macro level, I'm sitting here talking to you thinking, this guy's smart. He's quick. He's intelligent, yet I wouldn't feel ready to put him in front of a client tomorrow. Why? Because we still need to push it further that you can treat this like a conversation, like a discussion, like we're really truly just digesting, chewing on the problem together, rather than it felt like you were treating it like a test. You were treating it like a verbal exam, right? And I think even in the formality of the way in which you approach your answers, right? And things, just even little things off the top of the conversation, right? Truly, you don't need to like thank me for the information or anything like that. I think it was great you launched in. It's like this actually is a really interesting, situation for me. I've been considering getting into the life sciences space. Of course, I'm pursuing consulting right now, but this is an area of focus that I've kind of looked at, and if there was anything else you could tell me there about a particular class you took, or an internship, or a science fair project you did in high school, I don't know, like then great, like lay in that quick example, and that's nice. But off the top here, then we very quickly got into a really rapid fire pace of speaking on your end. And as I tried to kind of get to the next question or layer on, a kind of a little bit of a pushback or another insight, I even purposefully tried to kind of slow down my speaking even just a little bit more to see if you would kind of come on pace with me and start to be more on par with me. But I feel like even perhaps you've got like a rapid fire interviewer and they're just interested in, that's a great idea. Let's brainstorm this and let's brainstorm that. And then you can kind of feel like you're balancing and matching that energy. But I felt like today we just weren't doing that. And so it created a little bit more distance between me and you, because I want you to sit there and think like, okay, I'm going to be a future colleague to this person. I'm going to be an equal thought peer when I'm in the team room, when I'm around the whiteboard with them. So, okay, yeah, how would we think about this? What would it be? And so I want that collaborative team member. And I also want that kind of advisory stance of somebody who's going to be the client advisor moving forward. So both that internal and that external part of the role. I gave you kind of a lot of information up front, and then, you recapped it back for me. Even in this type of just kind of conversation, that still is the best time to then ask any clarifying questions that you have. And I agree with you. We didn't really get to, if you wanted to confirm your understanding of the business, right? Kind of talk through, well, I imagine that they're going to be really focused on the manufacturing, for example, right? Like if then I could have upfront helped steer you in a little bit of a different direction, instead of really a huge chunk of what you wanted to talk through in your structure for the next step was around manufacturing and kind of an operations lens. And that's not really where I wanted our focus and where I wanted the discussion to probably go. And that would not have been as applicable to this specific client situation and scenario. So yes, through the clarifying questions portion of the discussion, you could give me your perspective on what you think is important, or kind of how you imagine them to be involved in the various parts of the value chain, and then just have an opportunity to get my confirmation on that. We went into, let you go ahead and do like a full structure portion. You only took like a little over a minute, like a minute 15 or something, to be able to write out the structure. And so, that was fine. You ended up with a lot of content to be able to run through. But even in the moment, I'm like, oh, that was quick. All right. Okay. What are your thoughts? So if, you can, as you continue to practice, that 2-minute timer, you can really take like that, almost a full 2 minutes to be able to, if you want to think about it more deeply. Yet you had a lot of robustness to what you went through. That next section of kind of talking through the structure, it lasted almost 5 minutes. And so it was a little long-winded, and, you can't expand on every single bullet point within your structure. You got to be a little bit more punchy selectively throughout. You need to tell me a little bit about each category, of why you picked that category, or what do you think about the things in that category, but you don't really have the time and space to expand on every single thought that you have across your structure. And from that point and any other point onwards, right? When you are going to take a pause in the conversation, I want you to assert that you're going to take that pause, rather than like, would it be okay if I took a few seconds and blah, blah, blah. Just say, all right, I'm just going to take a second to think about this. And it also, I think also, decreases that distance, right? It makes it a little bit more personable, like informal, collaborative. That that you're not having to gain my permission. And yet, if you asserted that you were going to take a few seconds to think about something or take a pause, and then I wanted you to go in a different direction, I would still interject and say, "Oh no, actually, like go ahead and talk it out with me like live," And so, just assert as you move forward, kind of consistently in terms of just wanting to getting to your main points faster, right? Tightening up your speaking. So as we were going through, what would be some of these different, ways that you would think about like getting to product launch? What would be some of those steps? I did need to nudge you to think about it actually in a more kind of linear, process-driven way. What do you think have been some of those steps? Initially, the way, from a content perspective, that it sounded like you wanted to answer the question again was still in the world of manufacturing and operations. So I felt a little bit like, is he able to release his agenda and start to think about it in a little bit of a different way? But with another nudge, you were able to do so. And I felt good about that. Of course, in a conversation like this, I am inherently testing the boundaries of your knowledge in each of these spaces. But it's not like a business skills test. It's really not truly me trying to figure out, are you an expert? Would you be ready to launch into this kind of space? But how can you start to break it down? How well does that match reality? And if I nudge you in different directions, when inherently, you're not going to have fully been able to brainstorm or fully populate ideas or fully answer the question, are you able to kind of stay on pace, stay in the loop, stay in the conversation with me? So when we're thinking about things like this 510K pathway versus PMA, right? It's like, okay, we got that clarification that this isn't going to be something that the client picks, but the FDA in the US, these are our two key regulatory pathways in this space. The FDA is going to mandate, they're going to say, okay, for you to be able to sell this to customers, for you to be able to treat patients with this device, here's what we need from you. Here's all the data. Here's the different studies that you're going to have to do. And it's this ongoing dialogue. It's this back and forth conversation with the FDA. And then they kind of get into the data along the way across the product design cycle, across the product testing cycle. So when we're sitting in this space, and I'm asking you what you think about those two different things, then I did have some desire for you to bring it more into the space that we're talking about, such that we're talking about medical devices, we're thinking about healthcare, we're thinking about, treating patients in a new way. So yes, simultaneously, we're going to need to be thinking about profit. We're going to need to be figuring out, okay, what's both the cost and the revenue side of the equation. We started to think through how we might think about pricing a product. And also, of course, the quantity that we're going to be able to sell is going to be largely determined by the patient need in the marketplace. And cost, you had given me already up until this point some commentary on manufacturing, operations, right? Negotiating with suppliers, et cetera. That's going to help us figure out that profit margin, that contribution. We're going to be able to figure out how it affects our profitability. Yet, what's the key distinction between these two different, regulatory pathways that I've laid out for you? One's going to be a lot shorter and one's going to be a lot longer, and it's going to include like clinical studies, and therefore it's going to be more costly. And so, we haven't talked anything about kind of the difference in those two things or any kind of quantitative data, but are you able to take the little bit of information that I gave and just kind of, think about that in terms of, well, I think that we're probably going to come up with devices that fit into either of these regulatory pathways. And as we would go into developing something on in the PMA side, then those clinical trials, it's going to take us longer to develop the product. It's going to take us longer to product launch. You say clinical trials, and we would need data and research. Well, that's going to take a larger investment of money. And so we would just need to make sure, as we're kind of looking at the cost benefit of this type of developing different types of products, I imagine that what the regulatory pathway would be one of those critical factors in determining whether or not to move forward with it. Yet we're talking about healthcare. We're talking about increasing, patients treated, improving patients' lives. And so alongside those profitability numbers, I imagine it would also be important to our client that they would want to make sure that we're helping, improve the lives of our patients and, increase the number of patients treated across a number of different, disease areas, et cetera. And so, I would have loved if we would have gotten a little bit to number one, where you could have brought other parts of the conversation that we had actually already touched on into that part of the discussion. And number two, thinking kind of, in a more holistic way about, all right, well, what are we talking about here? We're talking about medical devices. These are things that are going to help people. And so, what's the patient need? What are in any of those kind of industry specific kind of words or phrases that you could come to throughout the course of the discussion would help me believe that you can, even without any exposure or knowledge, on this specific part before you came into this conversation, that you can start to think about it in that world. And we can start to, and so I brought that leg brace example into the conversation just to kind of have one thing for you to kind of anchor on as an example, but it truly wasn't, I didn't have a specific path that we were going to go on, down with that specific example, but just to give you kind of a data point of, oh, this would be something like what might exist in that space. So, all throughout, yes, I am thinking, can you structure? Can you keep your thoughts organized as we go through this discussion, as we bounce back and forth? Problem solving. Can you be robust in your ideation, right? And can you go through your thinking in that kind of linear way to get to an answer that makes sense? And communication, that internal collaborative team member and externally that client advisor. I think that tactically speaking, slowing down your pacing, giving yourself more breaths, asserting when you're going to take a pause, treating it more like a peer-to-peer conversation, all these things are going to be really helpful. So, Lance, really appreciate, again, you raising your hand and being willing to try this out with us today. It's been a great discussion.
Yeah, no, I really had a good time. And I think these are comments that I've never gotten before. So I think the speaking fast comment I've gotten before, but then a lot of the other things are really insightful in the sense that I really haven't heard about being able to ask about my assumptions within clarifying questions, or sounding, I guess, too formal in the sense that you're losing on the collaborativeness, even if I guess I tried doing that. So definitely a different perspective that I do appreciate.
Awesome. Absolutely. I think that's why kind of simulations are super important.